Radiopacity and compatibility. Cavity lining should ideally be radiopaque in order that the dentist can observe them on radiographs, thereby aiding the diagnosis of caries around the filling. A radiolucent lining material may hinder the early detection of such lesions. Finally, the cavity lining material choose for any particular application must be compatible with the filling material, which is placed above it. The constituent of the lining should not have any effect on the setting characteristics or properties of the filling. A technique to increase the retention of amalgam restoration using zinc phosphate cement has been described, in which a thin lining is placed over the tooth and the amalgam packed immediately. While the lining is still fluid, this may result in some bonding of amalgam to the tooth. This approach has been rediscovered with the advent of material that can be bound to the amalgam and tooth tissue. These materials are either glass ionomer cements or chemically active methacrylate based luting agents. Again, the amalgam is condensed against freshly mixed cement, which, with the deliberate intention of achieving a chemical union between the tooth and the amalgam to assist with retention and improving marginal seal. Some of the requirements of dental cements are covered in appropriate ISO standards. Many dental appliances and restorations are constructed outside the patient's mouth and then fixed into place using a cement luting material. Examples include the fixing of porcelain and material crowns, bridges, inlays, and metal posts. Many of the requirements of luting materials are similar to those of cavity lining materials. For example, the material should ideally be non-irritant. This requirement is not as critical for luting as for cavity lining, since the luting cement is normally applied to a thicker residual layer of dentine than would exist in a deep cavity. The setting characteristics should allow sufficient time for mixing the material, applying to the restoration, and tooth preparation for seating the restoration in the place in the mouth. The material should ideally be of low initial viscosity or be pseudoplastic to allow flow of cement lute so that proper seating can occur. If the viscosity of the cement is high at the time of insertion, there is a danger of the restoration being incompletely seated. For crowns, a thick layer of cement may be produced at the margins as illustrated in figure. An indication of the ability of cement to flow during seating is sometimes obtained by measurements of film thickness. A given volume of mixed cement is placed on flat surface and a predetermined time is compressed under a constant load. The thickness of the film of cement produced gives an indication of the flow during seating of the crown or other restoration. Luting cements should ideally give thermal and electrical insulations, since many of the restorations commonly cemented to the teeth are based on alloys, for example gold crowns. The retention of restoration depends on correct design and accuracy of restoration and the strength of the cement.